Welcome to the Tobacco Online Policy Seminar TOPS. Thank you for joining us today. I'm Xishan, Associate Professor at The Ohio State University. TOPS is organized by Mike Pascal at Georgia State University, Michael Darden at Johns Hopkins University, Jamie Hartman-Boyce at the University of Oxford, and me. The seminar will be 1 hour with questions from the moderator and discussant. The audience may pose questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guidelines on tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. Your questions are very much appreciated. This presentation is being video recorded and will be made available along with presentation slides on the TOPS website, tobaccopolicy.org. I will turn the presentation over to today's moderator, Jamie Hartman-Boyce from University of Oxford, to introduce our speaker. Thank you.
Thank you. Today, we continue our summer and fall 2023 season with a single paper presentation by Alex Liber, entitled Tobacco 21 and Cigar Sales. This presentation was selected via a competitive review process by submission through the TOPS website. If you'd like to present with TOPS, please submit your presentation proposal at a link that I will pop in the chat in a minute. As an assistant professor in the Department of Oncology at Georgetown University School of Medicine, Dr. Liber focuses his work at the intersection between markets, public policy, and public health. Dr. Liber received his PhD from the University of Michigan, Ann Arbor in 2020 in the Health Services Organizations and Policy Program with a focus on political science. Since 2008, Dr. Liber has contributed to the field of tobacco control policy research, first at Ohio State University during his bachelor's degree, then at Emory University during his master's degree, and then at the American Cancer Society as part of the Economic and Health Research Program. He employs quantitative and qualitative methods to answer pressing questions about the causes and effects of regulation, particularly in the areas of tobacco control and novel tobacco products. Outside of work, Dr. Liber enjoys exploring Atlanta, Georgia, where he lives with his wife and 2 children. Our discussant today is Michael Darden, an associate professor at Johns Hopkins University. Dr. Alex Liber, thank you so much for presenting for us today. Over to you.
Thank you, Jamie. Well, welcome everyone to my presentation entitled, Did Tobacco 21 Laws Affect Cigar Sales? Evidence from Survey and Sales Data. And I'm Alex Liber, I'm at Georgetown University. Thank you and for welcoming me back to TOPS. I'd like to start the talk with some acknowledgements. I'd like to thank the folks who have helped me co-author and refine this work, Mohammed Jaffrey, David Levy, Chris Kadam, Radhika Ranganathan, Abby Friedman, and Mike Pesco for their efforts to date. The work is funded primarily by a pilot project subgrant of the Tobacco Center of Regulatory Science based at Michigan and Georgetown called the Center for the Assessment of Tobacco Regulations, and it's also supplemented by an NCI loan repayment award. I have no conflicts of interest to declare. However, I have performed consulting work for the World Health Organization and Johns Hopkins University on related subjects to the one being presented here. The opinions expressed here are my own and do not represent those of my funder and or employers, past or present, or those of my co-authors. So because this is a top seminar that is aimed across the Atlantic to be accessible to folks in Europe and Africa and maybe a little bit of Asia, I just want to start with the confession of a self-doubting American that I have to wonder whether or not it's a good idea to export a policy that really began in the United States to the rest of the world, simply because I suspect sometimes our motives are weird and what we do isn't always the best, but I really believe in applying evidence and science to evaluation to determine if an idea that we had worked and whether or not it may be worth trying elsewhere, because it's already been done at the federal level here. All we can really do now is improve it and then see what happens if it gets exported abroad, as so much has in tobacco control policy. So Tobacco 21 is going to be the subject of that consternation and self-examination today. And I'll just give a little brief on what the policy is. So Tobacco 21 makes it illegal for a retailer to sell a product, a tobacco product, to someone under 21 years old. Typically, it involved moving up the minimum legal age of sale from 18 years old to 21. There are a couple of U.S. states, as you will see, that maintained different ages of 19 as the minimum legal age of sale, historically for different reasons. Moving up the policy to the minimum age of 21 was first performed in Needham, Massachusetts in 2005. New York City was the largest jurisdiction then to follow, which happened in about 2014. And the rules around Tobacco 21 are like similar to the rules around alcohol. It's very much inspired by Americans' regulation of underage alcohol purchases, where in the United States, you can't purchase any kind of alcohol until you're 21. The federal government really led this adoption effort in the 1980s by conditioning federal funds to build highways on states adopting a minimum legal age of sale of 21 for alcohol. And for that reason, 21 is the age. It's a higher age than 18. And what it does is it aims to reduce youth access to a product that would be deadly and theoretically cause lifelong harm if they were to become addicted to it. A 2015 report through the Institute of Medicine contained models that estimated a U.S. federal Tobacco 21 policy, and by federal, I mean it would cover the entirety of all 50 United States and then subsequent territories. Such a policy would avert 250,000 premature deaths over the ensuing century. After this 2015 report, it was a flashpoint, and the policy spread rapidly at the local and state, and then eventually federal level 4 years later, which is exceedingly fast in American terms. And the policy rolled out everywhere. Turned out to be a very good natural experiment that we can all study, and that lots of people have studied. And I'm bringing my own spin to it here to look at one piece of it. Policy diffusion didn't stop at American borders. In fact, Sri Lanka, Honduras, Mongolia, Uganda, and Ethiopia all had Tobacco 21 laws that predated the American federal law. Sri Lanka's law actually went back to the year before, after Needham, and as did Mongolia's. They well predated ours, and they aligned with those countries' alcohol access laws. However, after the U.S. law, Philippines and Singapore, and actually Prince Edward Island province in Canada also adopted Tobacco 21 laws. And it's also interesting to note that except for Sri Lanka and Mongolia, all of these countries maintain minimum legal age of sales for alcohol of 18. So Tobacco 21 itself probably seems to have driven its own success in proliferating to these other countries. But that means there's lots of the world that hasn't done this. And so there's room to grow and to examine the policy to see if it's worthwhile for anyone else to adopt. My team at Georgetown is conducting a systematic review of led by David Levy and Eugene Juan and Jasmine Lee. They're conducting a systematic review of Tobacco 21 policy effects. I'm very happy about that work, but I'm not going to fully summarize it here. What they found so far is that Tobacco 21, there's mixed to positive evidence that it decreases cigarette smoking, that it decreases e-cigarette use. There's a little bit of evidence that it decreases sales. I have contributed a paper that found that Tobacco 21 implementation in US cities decreased sales of cigarettes used by young people in particular. And we're going to be really sort of repeating that for cigars today. But my bigger question here is, well, what about cigar use? Cigars are now the second or third largest used tobacco product among young people, depending on the source that you look at. And there's been relatively little study of the policy's effects on that group. There has been a paper that found sales of cigars declined faster after Tobacco 21 in Hawaii, which was the first state to adopt Tobacco 21, than in the comparative state of California. A study in Cleveland, Ohio found that students were less likely to report smoking cigars after Tobacco 21 adoption relative to peers elsewhere in that city. And other than that, relatively little else has been done on cigar use. So I'm trying a policy that evaluation that has implications for long-term use, health equity, in that cigar use is disproportionately more popular among groups that suffer more health inequities in the United States. This is what past month usage of different tobacco products looks like in the National Survey on Drug Use Area Health, or NISDA. Over time, since 2001, cigarette use has plummeted. There was a revision of the survey in 2020 and the methods that it used, I think partially in response to the pandemic, but also planned a little bit before. And you really aren't supposed to compare pre-post estimates very directly. That will come into effect in a minute. But notably, cigar use has declined among young people, but not to the same degree that cigarette use has, at least over the last 2 decades. ENDS use is now, and by ENDS I mean e-cigarette use, is now the most popular tobacco product, which is what all the surveys agree on. So the plan of this project that I'll be showing is we will first want to look at whether or not cigar sales were affected by Tobacco 21. So in order to do that, we have to look at and identify what cigars do young people smoke. We're going to use the National Survey on Drug Use and Health to calculate which brands are consumed by people who are under 21, and we'll split them into a couple of groups. There's some problems to this that I'll get into, but overall, what the idea is that there should be a treatment group of brands and a control group of brands, and one that's sort of in the middle in terms of how much how much their sales should be affected by Tobacco 21. Because if young people don't use a particular brand, it shouldn't be affected by this new policy. Second, we need to identify where Tobacco 21 laws were put in place. And I'll show you that this gets complicated quickly because of American federalism and our layer cake federalism, as we like to say in political science. And so we'll collect data from various databases and put them all together and show you the difficulty of coding up Tobacco 21 just in this instance. And then finally, we're going to look at sales data and apply rigorous difference in difference analyses using all the latest methods to determine if sales of Tobacco 21 laws decreased, or if Tobacco 21 laws decreased sales of cigars. And hopefully we'll have met all of the conditions to make a potentially causal statement by passing parallel trends tests and other necessities. So I'm going to walk through the methods and the data, and after that, we'll have a little pause for questions before we roll into results. So how do we identify what cigars do young people smoke? We are going to use the National Survey on Drug Use and Health, as mentioned before. We're going to look at the 2014 to 2019 data, so before the methods change, and what will actually sort of match up better with the data that we have looked at in this study. We're going to look at approximating the number of usage days because NISDA doesn't actually get the number of cigars that people smoke each day, consumed by every individual person in the survey, multiply by their survey weight to obtain a consumption weight. And this will allow us to calculate, based on knowing the age of every person in the survey, the proportion of cigar days that are responsible for by people under the age of 21 relative to those over the age of 21. And that should tell us what brands young people are going to use. We're also then going to compare whether or not a particular brand has a higher or lower share of under 21 consumption relative to the rest of the sample. So if we have brand A, we will look at its under 21 consumption share and determine whether or not it is significantly different from all the under 21 consumption share minus brand A. And that will allow us to assign cigars into groups for further analysis. So cigar brand shares of under 21 consumption brand shares are going to be plotted here on these purple metrics, and the brands themselves are listed at the bottom. Don't worry about them here. I will show a few of them in larger pictures. But what is important here is that that orange line in the middle is the mean of the consumption without that particular brand. There are a couple of changes in that mean, and they're caused by the the dominant brands in the cigar market, which are Swisher Sweets and Black and Mild, also called Middletons. These are owned by Altria and Reynolds American, and I think I might have made a mistake on the Swisher one, and somebody can correct me. The brands I have identified as young here will constitute a much larger share of the market simply because of the presence of these two large brands in it. I'll talk about that, and I'm up for feedback on how to handle this because it sort of takes away some of the precision here. But nonetheless, what I do is I identify there are brands that are young, there are brands that have age proportionate under 21 consumption, and there are old brands, and those have disproportionately low under 21 consumption. So these are the young brands that are going to be of import, and when we talk about young brands, we're going to be talking very specifically about Swisher Sweets, Black and Mild, Dutch Masters, Al Capone, and then the most disproportionately young are going to be White Owl and Backwoods. Backwoods is a particularly interesting one because it used to be classified as an old brand back into the early 2000s, but it has shifted very young over the ensuing years, and it's a particularly worrisome thing. But these are what I'm going to call young brands, and I will aggregate their sales and adjust them per capita and log them to show you what we're going to do to analyze them. These are proportionate brands, so they have a level of under 21 consumption that is equal to the mean of the market without them contributing. So this is Garcia and Vega, Game, little filtered cigars like Winchester and Prime Time and Captain Black, as well as Game's Zigzag Cigarillos. There's also a couple of large cigars in here that came in that way, Monte Cristo in particular. So I couldn't classify them as old. Typically, large premium cigars are classified as old in the NISDA data. It's just possible that one or two people, young people who claim to use them, threw them into the proportionate category. It's possible because the numbers may not be super huge, or young people may be into them. These are old brands. So these are brands not used by people under 21. So if there's some people who are like myself and in their mid 30s seeing Jarum here, the Clove cigar brand, and feeling quite old, yeah, it is no longer used by the youth. But this is made up of large premium cigar brands, Phillies brand, as well as little filtered cigar brands like 305's Clipper and Remington and Jarum. So those are what old brands are. Okay, so then once we know what the different cigars are, we have to figure out Tobacco 21, and characterizing that is not easy. There was some really great work done by David Colston, then at University of Michigan, now at UNC pursuing his doctorate, measuring sub-state Tobacco 21 policy variation, and he put together a brilliant data set of coverage levels and posted it. Check it out. I combined that with CDC state database, that's their tobacco policy and database, documenting state Tobacco 21 level laws. I control for grandfathering pre-existing T21 policies, and then we have to document federal policy adoption. But this requires piecing together a complex policy implementation database. And so I asked ChatGPT to come up with a quick summary of what the US federalism layer cake actually works like. So Tobacco 21 laws have been passed at the federal, state, and local level in the United States, and all have different funding powers, responsibilities, and funding. And so this is how it describes it. Tobacco 21 laws in the United States unveil a multi-tiered governance dance, echoing the layers of a delectable layer cake. With a federal nod, states possess the authority to whip up their regulations, harmonizing with federal standards of crafting their distinct flavor. County and city layers further embellish the confection, sprinkling localized enforcement nuances. Picture a layer cake: the top tier, federal guidelines; the middle, state statutes; and the bottom, local ordinances. Together, this intricate federalist fusion ensures a palatable symphony of tobacco age restrictions, a governance cake that's both uniform and regionally spiced. And as weird as it sounds, that's actually how it works. There's different levels of checks, rules, enforcement powers, and punishments. It's messy. But what it effectively means is that we have to account for all of them because retailers are subject to all of them. And the sales that they make are subject to all of them. So we got to document them. So here we have plotted state tobacco 21 enactment dates. This is the date in which states passed tobacco 21 policies, and it ranges from 2015 through 2022, at least here. And they're noted here. There's just a lot of detail, so we're going to go through it as fast as we can, and these slides will be available for you to peruse later. State tobacco 21 effective dates are later or sometimes the same date as tobacco 21 policies at the state level. And so we've actually documented a gap in the how many days it took to enact a policy and then to reach the point where all 21-year-olds in the state could not buy tobacco. And that's on the left side. And it stretches into years. It turns out in certain states that grandfathered in a certain sense, they let people who were already able to buy tobacco after the policy went into effect to continue to buy tobacco. So no one who is, say, 19 years old in Massachusetts when that policy was when their tobacco 21 policy was adopted was ever prohibited from buying tobacco. They had to wait until the cohort who was 18 at the time, aged to 21, to actually officially be considered having a fully implemented tobacco 21 ban. And then, so we have to account for that. And luckily with sales data, we have a lot of granularity of time that we can do this, account for this stuff in. And then we have to account for pre-existing tobacco 19 laws, because obviously the pool of people who are eligible and affected, eligible to be affected by tobacco 21 law was smaller in these states because 19-year-olds were not allowed to buy at that time. So before tobacco 21. And further, there were local tobacco 21 population coverage levels before state laws. And so this documents the maximum T21 level in a state before they went to a state law. And so New York and Massachusetts sort of stick out as really high, approaching the 70% level with local laws before the state law kicked in. And then federal T21 is a whole other mess in the sense that the law was signed in December 2019. A rule was sort of the first federal charges in the FDA compliance check and database were made in February 2020, but they numbered in like a dozen. And then an official rule was due in March 2020, but then events intervened and no official rule progress report was offered. A rule delay justification report was supposed to be delivered in June 2020. None ever was, and that was missed. And in August 2021, only then did FDA stop charging the federal statute for selling to an under 18-year-old. And at that time, they stopped using underage, and by that I mean under 18-year-old purchasers and undercover buys. And then in March 2022, Senator Tim Kaine, along with some of Virginia, along with Dick Durbin and Mitch McConnell, all very important senators in the United States, asked FDA to justify why no final rule on the tobacco 21 law had been offered. So it's in this law that's in a weird limbo that there's no federal rule. It is definitely the law of the land. There are rules being charged. There are people being charged under it, but its implementation date is really uncertain, and we don't really know if it happened in December 19. So we have to do a little bit of variation to figure that one out. This is a chart of charges that were levied against retailers and undercover buys. The green line is people who are charged under 18, the old under 18 rule, and that didn't really stop until August 2021, as I said before, and charging didn't really start for under 21 until the middle of 2021 as well. There was this gap where people were not being charged during COVID because infection stopped. So it's a bit of a mess. And so specifying T21, we're going to use state tobacco 21 enforcement dates for our event studies and our main effect. Local T21 policy coverage is going to be noted, and it's a very important control. State T19 and T20 laws, sorry, oh my gosh, sorry. Need to be noted, T20 laws were caused by the grandfathering that went into effect in some of those states with large implementation gaps. We need to also document when T21 laws were enacted but not enforced. And then we have to have some variance around when the federal law came into effect. So we'll show what that all means. Finally, I'm going to show Nielsen data. This is the sales data that I use. It's from Nielsen ScanTrack. It's picked up from the beeper guns scanning UPCs in convenience, food, and drug stores in 24 states, representing 80% of the US population. It does not cover online, vape shop, or tobacconists. Tobacconists are very important in the cigar market, and you're going to be needing to note that. It covers the period of stretching from January 2017 to November 2021, split into 4-week periods. This is done because 4-week periods have consistent makeup in terms of weekdays, weekends, and relative to calendar months. So they're a lot better for companies to use to track sales because they sort of standardize and control for the different makeup of months. These are the Nielsen ScanTrack states in green. And so this means that these state tobacco 21 laws, the ones that are not in gray, are the ones that we capture. California's is the only state tobacco 21 law in our database that predates the beginning of our policy, so of our window to look at the policy. And so that means California actually won't affect event studies because it doesn't switch groups and it doesn't act as a treatment, or it doesn't act as a control. These are our additional state control variables. We have extra tobacco control variables. We look at the percent covered by a ban on the sale of flavored cigars. This has been put together by Liz Truss at Yale under the direction of Abby Friedman. And we have additional papers coming out with explaining that. It's pretty important in terms of affecting cigar sales themselves. We have excise taxes for cigarettes, cigars, and ends. Cotty et al. Put together the ends tax thing. The cigarette and cigar taxes are all at the state level. We don't handle local taxes here. Percent covered by a workplace smoking ban, also put together very helpfully by Mike Pesco and I think Serena Phillips. Policy and environment variables are also going to be controlled here, and this is about recreational marijuana or cannabis sale and medical marijuana sales, unemployment rates to capture general economic trends, and heating degree days, which is the number of days in a month you have to turn on the heat, at least the proportion of the month, to keep things warmer in your house because it's cold. So that's what a heating degree day is. It is about seasonality, and it's actually quite important and robust in these analyses. Finally, these are the analytic methods. We're going to estimate difference in distance estimators. We have multiple groups with staggered, potentially non-binary treatments. And it's this Deshays, Martin, and Dafoe 2020 version. Hopefully, it enables causal trends if parallel trends are established. And our main dependent variable is log per capita unit sales, split by the age group and a little bit of stratification by flavor. It's only going to go for the young brands simply because they are so large. And this uses this data command DID multiple GT DYN. We estimate 6 placebos and 12 treatment groups to estimate sort of the half year before policy implementation at the state level and the year roughly after. I'm going to stop here for questions. We are at 9:30, so thank you. And hopefully I will be able to be efficient through the rest of this.
Wonderful. Thank you so much, Alex. First off, I'd like to hand over to our discussant, Michael Darden, for any questions you might have at this point.
Thank you. Yeah, so a lot of information in 30 minutes there, Alex. That was very nice. Great to discuss this work. So Alex and co-authors, they've put forth a very clear question, and they have answered it with, I think, frontier methods. So congratulations on that. So one thing that's just not clear to me as an economist is your emphasis. You really emphasize brands here, and I typically think of like brand substitution as like an economic kind of question. It's not clear to me that it's a real policy relevant question in this case. I think you're using brands, and I'm basing this off of the slides, so please correct me if I'm wrong, but I think you're using brands as a source of variation for the internal validity of this type of experiment. So I would worry some about measurement error here, and how you classify some of these different brands. And the one that really struck out to me looking at the slides was this primetime brand, which
Mhm.
seems to be, at least according to your graph, a higher proportion of youth consumption than Black and Mild, and you emphasize Black and Mild. So can you talk a little bit about measurement error, especially in the context of like what you have described really nicely as a very messy kind of policy environment?
Yeah, so that's a great question. And so prime time is considered age proportionate simply because it doesn't have the same market share. So the Black and Mild estimate here has a very narrow confidence interval because it has, I think, 2,000 people who said that they used it. And the number of under 21s who used it was quite substantial. So versus primetime, if I recall, has something like 40 people saying they use it in total, and then a subset of those are under 21. So there is certainly measurement error, and things might fall into the proportionate group simply because they don't have enough people who answer NISDA to know. However, we're pretty good on the knowing that Black and Mild is higher than the population average without. And I think we're just going on a very strict definition on being able to tell whether or not the share is lower, this not distinguishable from, or higher than the mean without it in contributing. So it's a strict definition, and it produces some things that are not super precise sometimes. But yeah, the idea is to get some internal validity that there should be a larger effect on young. There should be some effect on proportionate because young people theoretically do use these brands, and there should be almost no effect on old brands of a tobacco 21, or at least it should just be. And this sort of should tell us whether or not we are seeing something that is non-random and more likely to be. It's part of the causal story of whether or not we believe the results.
Okay, so then if I look at the old here, Cohiba, that's 5%. This is the share cigarette brand under 21 consumption, so 5%. So you're saying that there should be no real effect on Cohiba.
Yeah, at least it should be a lot harder to detect. Yeah.
Okay. So yeah, not having seen any of the estimating equations here, I mean, do you worry about like multiple hypotheses here? So I mean, you have a lot of stuff going on, including the placebo analysis. So are you going to correct for that?
I do my best to sort of establish whether or not there is any difference before the policy change comes into effect, and there has been a umpteen number of policies that have been considered. And I do worry that there would be contamination.
Well, I'm not thinking about contamination. I'm thinking more of just the fact that you're going to be running hypotheses tests for all of your pre-trends, right? You're going to be running hypotheses tests for all of your results. You've got 12 placebos or something like that, right? You're bound to find something significant with that many, right? So are you going to try to correct for that?
Yeah. I guess the placebo tests that I'm talking about are the placebo periods beforehand, but before policy implementation. And yeah, I would have to talk to you more about exactly what that would mean. I will identify a pre-trend issue and identify sort of like when that does go wrong, because that did go wrong and proved to be a very difficult part of this project. And I have some explanation for it that I can't correct away. At least I don't have an idea yet. And this has to do with the unlogged outcomes. So I'll show that when we get to that. Yeah.
Last question, I suppose. Your study period includes COVID, right?
Yes.
And so how, this is more a general question for anyone really. How is it that differences that literature is thinking about trends during this period?
So
Is it that COVID has kind of hit the treatment groups and the control groups in the same way? Do people buy that?
So theoretically, we can test for it and throw COVID variables of different kinds of policies in there. I have tried all kinds of COVID variables in here and they don't seem to move anything. I've tried everything from movement trackers that Apple Maps provided on the amount of walking, transit, and driving people were doing. I've tried policy trackers in here. We've tried death trackers and case trackers.
Okay.
Weirdly, the two-way fixed effects setup doesn't seem to, or seems to soak up enough of the variation during COVID that those didn't drive outcomes. As for whether that makes sense in the sales data context, I kind of get it. Sales data are sort of collected passively in the sense that no one is going out there and having their methods change to produce this data during COVID. And so I think it's less susceptible to sort of like, say certain states would have limited in-person interaction and survey taking during that period, and then also been more aggressive on clamping down, say, on flavored tobacco products. I think that would have been more of a concern if we were looking at something with like survey data. But I'm more confident in the effect during with sales.
Okay, Jamie, I'll turn it back to you.
Great, thank you. I'm mindful of the time, but I'm going to throw two quick questions at you from the Q&A. Alex, just to clarify on methods.
Mm-hmm.
The first is just to remind us how you know which brands are being consumed by under 21s.
So that's what NISDA is about, is that we're using the NISDA questions which ask people what is their most commonly used brand. And then sort of assign, and we know their age and we know how many days a month they smoke. And so we combine all that information to say like, this brand is disproportionately used by young people and they're going to be called young brands. And so it's an indirect way of splitting out sales data to get at subpopulations. It's messy and it's not super clean because it just sweeps up all the people who are not young who can also use that brand. But we think of it as a way of there should be a lot more treatment in this group and a lot more control in this other group.
Great, thank you. And finally, kind of a broader question around how T21 is implemented for online sales.
Yeah, so it is a good question. You're not really, if I recall, allowed to ship non-premium cigars in the mail. And so that's the PACT Act. So that limits the online trade in these products quite a lot in the United States. And so while it is a concern, it has been found that age verification standards in online stores are quite bad. And it could be circumvented, but I'm just not aware that it would really apply to the sort of brands that we're looking at here. These non-premium main market brands, mostly that make up NISDA or that make up Nielsen.
Great, thank you. Without further ado, go ahead and tell us what you found.
Thanks. I will go as swiftly as I can. So this is the descriptive statistics slide. What we find here, the dotted line is tobacco 21 coverage rises from about 23% of the sample to 74% of the sample covered by the end of the study period. Young brands in purple make up 70% of this data in 2017, and that rises to 75% of sales in 2021. This is a bit of a problem because of the inclusion of Swisher and Black and Mild, and I have had versions of this that split out Swisher and Black and Mild, but it creates all sorts of issues in pre-trends. And so I'd love to figure out what's going on there. Proportionate brands fall from 25% to 21% of sales. Old brands fall from 5% to 3%. As for the proportion of the market that Nielsen covers, it's hard to say right now, and I kind of wish I could come up with a better number. I've attempted to do this for cigarettes and e-cigarettes and come up with decent coverage estimates, but the tax structure of cigars makes it really hard. So I don't know exactly what we're covering. We think it's a decent proportion. The cigar sales here total up over about $11 billion over these years. It's a fair chunk and of a market, but we don't know if it's closer to 20% or 50% of the market or 70%. And I'm sort of disappointed I don't know that. So this is the beginning of a lot of series of event studies that will be also serve as the results plotted in terms of average treatment effects. So I'm going to rely on the plus environmental variables model, which I also will call the full model. It excludes National Tobacco 21 in any form. I'm going to include the National Tobacco 21 coded as starting in June 2020 in these slides here. And you'll be able to sort of compare it visually from where it is relative to the full model. So for total sales, we find 4.2% drop. This is in log per capita volume terms. And it is statistically significantly lower so it was a statistically significant drop after adoption. And it seems to not violate parallel trends. Everything overlaps 0. Tobacco 21's addition, for the most part, does not affect the estimate. It might lower it might decrease or increase the effect in terms of a drop a little bit for total sales. For young sales, we record a 5% drop, so slightly larger than the market as a whole. It's still 75% of the market, so it's not going to be that different, but it narrows the confidence interval and drops it further. The effect of National Tobacco 21 also there's a bit bigger of a gap between young sales and the full model. For proportionate sales, you actually get the same point estimate, but a much larger confidence interval. We're not actually confident that there was a change from 0. It still also meets parallel trends, and National Tobacco 21 has a larger effect here too for age proportionate sales, brand sales. For old brand sales, these log units log changes look larger, but remember these are about a 20th or the size of the young brand sales in terms of per capita volume. And what we get here is no violations of parallel trends, but also with the full model, no effect on sales at all. And with National Tobacco 21, we almost get a statistically significant increase. It's a bit weird, but I can't explain it, but it's a small portion of the market, and I'd be interested to hearing ideas about why that might happen. Next, this is just sort of a way of using stock plots to show that our base models are not really different once all the variables are added in terms of their average treatment effects. This is just sort of another way to plot the effects here, with the exception of that federal Tobacco 21 law and old brands. So we have young, proportionate, old, and total brands here, not overlapping 0 in the case of young or total, but doing so for proportionate and old. When we split young brands into flavored and unflavored, we actually get very similar estimates of effect size. Unflavored brands, unflavored products in young brands had roughly the same policy effect. They both meet parallel trends, and they have roughly the same average treatment effects of a 4.4% drop. It's a bit interesting that it's different than that it's a smaller percentage point drop than the full model. I'm not certain why. I need to investigate that further. And then here I'm going to show a reason why I had a hard time with the unlogged models. That about 4 months before policy adoption, you can see right here, I have pre-trend issues where the confidence intervals are on the wrong side of the line. And so it made me very unwilling and unsure to press forward with this research, and it held me up for a while. We found out that logged variables behave better, but it is worrying to me that there is this pre-trend issue. I will show one reason I think this might have happened. towards the end of the time. But yeah, so these are what happen. So that's what it looks like for total sales. When you look, at splitting this out into young flavored, young unflavored, proportionate, and old, you'll see that the largest effects here are still for young unflavored, with very large confidence intervals, and then going upwards to flavored and proportionate and old. This young unflavored versus outperforming in terms of a larger drop than flavored is interesting and not what I would have expected prima facie, because flavored cigars are supposed to be more appealing to young people and more often reported to be used by young people. However, NISDA does not actually contain a question on cigar flavoring, which I'm sort of sad about, because I can't split out the brands and assess whether or not, say, White Owl flavored versus White Owl unflavored have a different demographic. This is often the case for cigar brands or for cigarette brands, where Marlboro Menthol has a much lower average user age than Marlboro unflavored does, and it's an interesting thing, and I wish that NISDA had more information on it. So we're going to go through some sensitivity checks. We looked at the effect of the different National Tobacco 21 dates. So the one in green is the June 2021 we use in the previous one, the previous slides. However, the Tobacco 21 counted from signing produces a much larger drop. I don't totally understand why. And looking for that than does the June 2020 or August 2021 date. And this holds up across young sales. It holds up across age proportionate sales. Doesn't totally hold for the old brand sales, but again, this is working on, I think, a quite small amount of sales. This is a drop one test. So when we drop each state from our model and see what that does to the results, notably dropping New York causes the total sales effect to go to not significant. Same with Washington. New York had a lot of Tobacco 21 coverage beforehand. I'm not sure what causes Washington to do that. Otherwise, the fact of significance is not altered by the other states being dropped out of there. Notably, the young brand test is robust to dropping any state from it and maintains significance in negative direction the whole time. Dropping no state affects the proportionate model. Same with the old brand test. All right. So we're going to finish up. I think that I reached the conclusion that state tobacco 21 laws likely decreased cigar sales by around 4%. I think this decline was slightly concentrated among brands used by under 21s. Unexpectedly, I think flavored products were affected a little more, and it could point to substitution effects or uneven enforcement among the kinds of brands that people prefer in different areas or in different demographic groups. Further work must look into the mechanisms behind what caused whatever change I'm seeing. There's a lot of limitations here in that 75% of the market was classified as youth disproportionate, limiting precision. And this is caused by not being able to split things by flavor, which would have helped a great deal. There's this unlogged sales pre-trend issue, which I'm trying to solve at some point. I'm up for advice on how to get this through over the line and maybe how to address it. Local Tobacco 21 enforcement and information was also not available, as was a lot of, we were not able to apply local taxes and other things like that because we didn't get to there in the methods. One thing that could have caused the pre-trend issue, as far as I could identify it, was there were certain states that when you did a drop one test, you could focus in and find out there were certain products that were coming in and coming off the market in a manner that made it look like sales were dropping in these categories before policy was implemented. And this particularly had to do with summer special edition products from Swisher Sweets and White Owl. This points to a whole other policy failure of like the fact that these products are allowed. They are highly flavored. limited edition products that spike in sales for 2 to 3 months and then go away. This firework, this Jamaican Me Happy, this summer sampler, Swisher has hundreds of these limited editions. It's this whole thing, and it causes pre-trends, and I really want to know how to deal with this without like altering the data and actually what it says. Implications of the work, I think, are that Tobacco 21 seems to yield concentrated improvements and indicators important to the epidemic, namely underage tobacco sales and consumption. We need to look at finding out what version of Tobacco 21 works best. There's a lot of details around this policy that need refinement and need to move from the theory to the practical evidence base. I'm doing future work looking at those policy details, including the purchase, use, and possession provisions, and whether or not those affect sales of tobacco to young people or consumed by young people. And then I'm also looking at Tobacco 21 enforcement and whether or not Tobacco 21 passage itself affects whether or not retailers' behavior changes. And that's another key part of this causal story. With that, I'm going to stop here at 9:51 and ask for further questions.
Fantastic. Thank you so much, Alex. Once again, I'm going to hand over to our discussant, Michael Darden, first, and then add in some opportunities for questions from the audience.
Thank you, Jamie. Thanks, Alex. That was a great presentation. Very interesting results. I want to have my final questions kind of be focused on the bigger picture, which is good with this slide. So, earlier in the presentation, you cited an Institute of Medicine study that said that it was, I think that study was a forecast of what these laws would essentially get us in terms of health benefits and longevity savings. So I'd like to know, if we believe your results, should we update that number in their study in any way? And comment on the methods of that study if you want, but would your parameter estimates be useful in a study like theirs?
So I haven't worked on turning these into parameter estimates, but what I can say is that I work very closely in a hand in glove with a group dedicated to tobacco policy modeling that was involved on that 2015 IOM report. That 2015 report was based on the experience mostly of Needham, Massachusetts. And there is a great deal of evidence that has emerged in the coming years that it needs to be updated. They are working on right now comparing whether or not the parameters that have been produced by all the other people working on, particularly survey data based estimates in terms of initiation and cessation rates, whether or not those are really the kind of things that should go into the model. I sort of view this data as useful for say forecasting text changes, but I'm not so ready to translate this into a number of people who did not initiate yet. That is definitely a bridge I would love to cross one day, but modeling, but the sales data work needs a lot of work before it can be translated into a one-to-one person behavior. The work on brands allows us to actually, I'm very proud of that because it allows us to talk about population subgroups smaller than a geography that you can't do with most other sales data work. But it's still a push for me to be able to consider getting to what happens to an individual person's likelihood to initiate smoking.
Thank you. Do you think that if you were, I don't know if you've done this, but if you were to rerun your analysis exactly with the right-hand side of the equation as is, but with the left-hand side of the equation being sales of e-cigarettes or sales of cigarettes, would you find anything there?
I think I would. So I have done previous work on the cigarette sales and a little bit on e-cigarette sales using slightly different techniques. The e-cigarette one was buried in a paper bottle volley, but we found very robust effects of Tobacco 21 on e-cigarette sales. And the effect on cigarette sales were smaller. And that's primarily because young people make up a really small portion of the cigarette consumption user base at this point. it is around like 0.8% of cigarettes are now consumed by people under the age of 21. This is like 2020 to 2021. E-cigarettes, it's probably much higher than 0.8%. Cigars are definitely in the middle, it seems, but we can't get to the number of cigars very neatly yet. We could use PATH, but I don't love its representation relative to his.
I mean, I ask more because of the kind of unintended consequences of something like this, right? So if Cigar 21 sales come in and you want to forecast, what's the effect of these Cigar 21 laws, we want to know what the effect on cigar consumption was, but we'd also want to know if the extent to which these things push young people towards other products. So maybe I prefer e-cigarettes, but cigars were available because of 21 laws, and now as a result of every tobacco product being 21, I'm just going to try to acquire e-cigarettes. So do you worry about those kind of unintended consequences of the policy, or could you build that into this framework?
No, I actually don't really worry about that particular formulation of a problem, because one, every single one of these policies was not just applied to all tobacco products broadly, and I don't think any of them specifically pointed to cigars specifically. So this isn't about creating a relative advantage for those other products relative to cigars. I think it's just sort of a way to precisely target the behavior of a particular group of people in this particular age band, and to just raise the barrier for starting smoking for a few more years that we believe are critical to development. I honestly, Tobacco 21, if enforced it properly, with penalizing the folks who profit off of sales to young people, and not levy to criminalize young people, I think it can be a pretty decent policy without a lot of worrisome side effects. That's what I'd say.
Jamie, we have 3 minutes left, so I'll kick it back to you.
We do. Thank you so much. So a couple more questions, Alex. If we don't get to all of them, they'll all be shared with you after, and there's also the opportunity for people to join Top of the Tops afterwards to ask some more. But we had one question through on whether or not there's any data on how T21 affected the black market. That might be out of scope here, but I didn't know if you had any thoughts on that, Alex.
T21 affected the black market. Black market in cigarettes and in tobacco control is a very useful tool for talking about literally any tobacco control policy in any particular place in the world at any particular time. Its measurement is difficult, but there are people who specialize in understanding the size, scope, and changes in the black market, and they perform very specific and well-developed techniques like littered pack surveys, pack collections during population surveys to assess and the size and changes in that. So I would say, one, I can't really look at that through Nielsen data, because those would theoretically be out of scope unless you catch a retailer selling a kind of product that's been banned in a particular place. And that does happen. But usually sales data indicates good compliance in Nielsen retailers with, say, like a flavor ban. So I'm not worried about a blooming black market. Social sources and gray market sources are very important to youth tobacco access, even in the presence of a T18 law. So it would change maybe the nature of a gray market, but not probably a black market. And by gray market, I mean informal sales and sharing, not driven by organized crime.
Okay, thank you. And one more question on methods, which is about once brands are determined to be young or old, how do you then account for the proportion of sales of those brands that are old or young, with the concern being that brands like Swisher Sweets and B&M are the lion's share of sales, so if all are deemed young, the implications, the effects might be a little less clear.
Yeah, I want to develop a technique, and if anyone has an idea on how to do this in these very neat difference in difference models that accounts for those relative variations. I'm interested in working with you. One initial point of this project was to try to do that and use that particular variable, but I just became frustrated and couldn't make it work the way I wanted it to. So the answer is I don't yet do that, but I really want to develop that ability. And I'm open to talking to whoever's interested in figuring out how to do that.
Great, thank you. And you were so quick at answering that I'll squeeze in one last methods question and then conclude us, which is that you calculate per capita sales data using county level population by age. I think this is a question whether or not you can clarify why you wouldn't just look at the percentage change in sales instead.
So I think when you log the sales that are in per capita terms, one, we use per capita terms because we don't want different states to contribute more or less to the outcome because California is bigger than Massachusetts, and we want we log because that will produce that percentage change outcome that you're looking for. So I think that's sort of a two-part question. Yeah.
Perfect. Thank you so much. So that's all we have time for right now. I'll hand back over to our MC to close us out.
Thank you. We are out of time. However, if you still have burning questions or thoughts for Dr. Liber, you can join us for Top of the Tops, an interactive group discussion offered immediately following select Tops events this season. To join, please copy the Zoom meeting room URL posted in the chat and switch rooms with us once this event concludes. Thank you to our presenter, moderator, and discussant. Finally, thank you to the audience of 165 people for your participation. Have a top-notch weekend. Thank you. The URL is in the chat. See you there. Bye.